In this series, we're going to go from foundations and awareness to stamina and strength building, seeing how you progress. So part 1 is going to be foundations and awareness. It's going to be very simple, a lot of breath work, a lot of seeing where you are balanced or imbalanced, how much control, how can you connect all these different parts like your pelvic floor and your breathing and your belly activation all at the same time. It's basically coordination. So think foundations and awareness. You're going to be really mindful and you're going to focus on quality over quantity. So you could do a set number of reps or you could do 3 really great in a row. So it doesn't matter to me what you choose to do. I will pick a set number for the sake of the video, but you do what you need to do. So quality over quantity. Make sure that if you're doing this and you're postpartum, you have back pain or any other issues going on, or even if you're a beginner but you haven't started anywhere, make sure that you are healthy and your healthcare professional has advised you to do this, or in the case of postpartum or back pain, cleared you to do this. Another thing to think about is breathing, right? I'm going to cue specific breath patterns, but just remember to breathe. Don't pass out. You're doing it right. As long as you don't pass out, you're breathing. And we are going to focus on breath though, so we can practice getting the coordination of your respiratory diaphragm, moving with your pelvic floor, with your belly, and all of that good stuff. And if there's any pain or discomfort at all, you want to pause. You want to find a position that you have minimal amount of discomfort. Let your body rest. Let your breathing calibrate, get level, get even with your breath. And then maybe you pause. And maybe you can revisit the next day or the next week when maybe the pain or the discomfort is not quite so acute. All right, that being said, I do have a few props here. So I have a yoga block and I have one of these squishy balls, one or the other. You don't have to have both. And if you don't have either of these, I use just a little cushion for my sofa, like a pillow, a throw pillow. And I've got a towel here for head support. Again, can be a pillow. So you can just use household objects for this. We're basically going to be doing 3 exercises and they're going to be very simple, again, very basics. This is foundations and awareness. So let's get moving. You're first going to pad up. I'm going to lay on my side and roll over onto my back. So I'm very safe in my spine. If you have diastasis, you've got to be really safe there so that you're not straining that line. And I love to just kind of wiggle around, right? So a lot of times, we lay on our back and we either automatically tuck our butt under because we're like, oh, we're supposed to be flat, or maybe our shoulders go up like this and our neck pulls. So if I'm kind of shoulders rounded, you're going to take a little time, you're going to give yourself a little more head support so that your shoulders and your ribs can drop back without your butt being crazy tense there. We are going to be moving the pelvis, so you're going to be able to move both directions without your ribs going up, because especially postpartum, we're really open in this front line. Ribs have been separated, all of that stuff has been open, so we're just going to see if we can let that soften back. And part of that is taking the time to set yourself up for success, right? Propping yourself up correctly for your body. And hopefully, as you progress, it will change. So, I'm going to figure out where I need to be. And the first thing we're going to do are pelvic tilts, right? Very basic. It's like tuning into the dials on a radio station. So I'm going to use the block between my inner thighs. Pillow, block, ball, whatever you like. And when you decide what you want, you can keep it there. Or if you decide you're like, this is throwing me off, don't use it, right? And the first thing we do is just take my hands to my pelvic bones here. And these are, usually if we say put your hands on your hips, this is kind of where you'll put them. These are truly your pelvic bones. In the front, they're called your ASIS. And then your pubic bone down here. And neutral or level between the pubic bone and the ASIS is kind of the optimal position, especially for when we're standing. But we're going to be moving through this. So we're going to breathe here. And as you breathe, allow your whole trunk to expand in all directions. And as you exhale, let your belly sink back. Sometimes I'll imagine I'm fogging a mirror with my exhale or blowing through a straw. Everyone has their different preference. And as I do that, I'm going to allow my pelvis here, these pelvic bones, to tip towards my ribs, towards my chest, towards my face, So I'm tipping my pelvis towards my face, imagining maybe there's soup in my belly. And then you're going to inhale, and you're going to allow your soup or your pelvis to tilt and spill towards that pubic bone, towards the feet. Exhale, roll towards your face. And I'm gesturing with my hands. You can just let your arms or your hands go where you need to. Inhale, rolling towards your feet. Now, once you get this movement down, you're kind of like, okay, now I know what she's doing. I know what I'm doing. Start to observe yourself. Remember, foundational movement and then awareness into how you move. So here you are, rolling back and forth. Exhaling, hollowing the belly back, sinking the belly back, tipping the pelvis towards your face. Inhaling, rolling the pelvis forward. Notice if you have a little wobble side to side. You can observe, I've got the block here just to hold my legs accountable, really to connect my legs and my pelvis back to this center line as I do this. That's because I'm postpartum, right? I'm postnatal, so I'm trying to build Humpty Dumpty back to this midline. And then you're going to inhale and go the other way. And you just keep going with that. You exhale. I notice, okay, if I palpate with my hands around those ASIs, those pelvic bones, I notice one side's moving a lot faster, one direction. And can I level that out? And some of that's going to require my abdominals to get involved. Inhale, roll anterior, where you're spilling the soup through your pubic bone towards your feet. And then it's like the opposite side likes to go fast in that direction. Now, that can maybe be too detailed. So you just notice, is there a wobble? Is there one side that moves more or less than the other? And how would you get it to move as evenly as possible as you continue to breathe with this movement? We're going to do 2 more. Exhale, curling the pelvis under, hollowing the belly back as you exhale, exhale, exhale. Inhale, releasing forward. Inhale, inhale. Exhale, drawing the belly under, curling. Ribs and navel are dropped back. Inhaling, rolling forward. Can I roll center across that ridge of my sacrum? Do both sides of my pelvis go together? Depending on the day, yes or no, right? So each time is a little bit different. Then I want you to find a happy medium. And it's going to be best that eventually you transition this next exercise into a sitting and standing context. But it's really nice just to build a whole series that you can do while you're resting on your back, because one of the things, whether you're postpartum or even in pain, is that it's nice to rest and find places where your body can go, so your nervous system drops down, and then you can kind of gain new information. So this is another time where I like to have something pretty close to my pubic bone between my inner thighs. And I want you to practice a Kegel exercise. So the first one, I just want you to let your arms rest wherever you want to hold them. I'm just going to let my hands rest on my belly. Make sure my ribs are dropped down, my shoulders feel comfortable. You're going to breathe in. Your belly, the size of your waist, and your back should all expand. Your pelvic floor should even feel a little hint of pressure. As you exhale, I want you to do what you think is a Kegel. So what is a Kegel, right? Pelvic floor exercises. What does that feel like? Did you squeeze the block? Did you just knock your knees together? Did your butt tuck under? Did your belly pooch out, right? Did any of those things happen? Did you shift at all? Because if you're shifting, you're adding more than you need. So it's going to be more subtle. We're going to call it the pelvic floor elevator. The pelvic floor muscles being those between your pubic bone, your tailbone, and your 2 butt bones, these 2 ischial tuberosities, or your sits bones, as we'll commonly call them. So that diamond that you normally would sit on, that's the tissue. About 3 layers of tissue there, integrates with many different things, but mainly it's going to need to coordinate with your respiratory diaphragm, so your diaphragm up here that we use for breathing, and your abdominals. So that's why I'm having my hands on my belly. One hand kind of the top of my belly, one hand on the lower half of my belly. You're going to breathe in again. And on your exhale, You're going to imagine you're gathering pubic bone to the tailbone, the two sits bones gather, and they lift in and up as you exhale, feeling the belly gently pull in away from the hands on your belly as you gather in and up. Now, I didn't go anywhere. I didn't tip my pelvis. I didn't arch my back. You don't really see me move. It's just here to here. Mind to my body. Inhale, release. We're going to do it again. Exhale, belly pulls in, pelvic floor pulls in and up. And maybe you think, can I go to the first floor? You remember it's an elevator, pelvic floor elevator. Can I go to the first floor? Inhale, go back to the lobby. Maybe you even need to go to the basement and push a little bit. Maybe you need more stretch in your pelvic floor. Exhale, maybe you go to the first floor again. Maybe you go to the second floor. Exhale, exhale. Make sure you don't pull in and up so much so that you start to bear down in your belly, right? And then inhale, let everything release. Stretch it. Let your breath push, right? When you inhale, it increases the pressure in our abdomen all the way around, including that pelvic floor. As you exhale, gather in and up, pubic bone to tailbone, in between the two sits bones, gathering in and up. And I can feel one side is far more active, almost to the point of hypertonic or like too intense. Like it's overworking a little bit compared to my other side. So what do I do about that? Inhale, breathing in. As you exhale, gather and lift. I'm going to think about my slower side, the side that I'm not feeling as much. I'm going to see if I can ask it to lead. So I'm going to think, can I ask it to be a little faster, a little bit more on that side to help the more dominant side back off a little bit. I like to think of it as like codependence. One side's doing all the work and is trying to be a martyr, and the other side's like, I didn't ask you to do that much work. So kind of play with that. And then you're going to inhale and release. Two more like this. Exhale, pelvic floor elevator as you exhale. So my belly's pulling in and back. Pelvic floor is going in and up. I'm not tipping my sacrum. Keeping my tail. I'm thinking pubic bone to pubic bone. There's two sides to your pubic bone, by the way. So can the right and the left side come center? Can it gather towards the tail and pubic bone, two sits bones? So that diamond's gathering in and up. And then inhale, release. Last one like this. Exhale, pelvic floor and belly working with that exhale as you gather in and up. I like to imagine too with that pelvic floor, it's almost like I'm trying to suction whatever's between my thighs up the center of my body. And then inhale, release. All right, from there, if you've got something between your thighs, let it go for a minute. Wiggle if you need to. Maybe you tilt your pelvis back and forth. Now, sometimes our sacrums are so precarious that it's hard to do this just laying on your back, especially if you've got SI joint kind of dysfunction, sciatic nerve discomfort. So in that case, you can always grip with your hamstrings and glutes a little bit here. You can put something underneath your pelvis to give yourself a little padding. So a squishy ball, so it's not quite as abrasive on your SI joint, or if you've got sciatic nerve pain, you can definitely prop up for that because it can be abrasive if you're sensitive there. All right, so I'm going to add a little extra level for this next one because I really, really, really want to make sure my ribs stay contained, right? And then I'm going to figure out what do I need to do to get the majority of my back nice and connected. And I'm doing this not because you need to always have your back fully flat on the mat. I'm doing it so I have the most feedback because the thread is foundation work and awareness. And in awareness, I want to make sure that I have the most feedback I can possibly get. So from there, I want you to breathe in, and I want you to notice how far do you need to tip your pelvis to get your whole spine down, including ribs back on the mat, navel back on the mat, lower back, and then take your pelvis back down to what is a neutral or level position between the pubic bone and the hip bones, as close as you can, right? It doesn't have to be perfect, but as close as you can while also keeping those ribs down and also pulling the navel in the direction of the mat. So that's how you're gonna find that position. Just peek at the knees, make sure they're level. I'm going to take something back between my legs, walking my feet together, and this is the first level. So this is part A I want you to explore. I want you to breathe in, and on your exhale, pull your feet towards your butt or your butt towards your feet, whatever you want to think. Sits bones to heel, so ischial tuberosity, heel connection. Back line of my leg activates just a little bit. I'm hugging whatever it is between my thighs. I am going to hold myself as stable as I humanly can from my shoulders and ribs all the way down to my pelvis and sacrum, holding this exactly as it is. It doesn't matter if it's a little tipped in your pelvis or completely neutral in your pelvis. Hold it steady is what matters, right? What is the priority? Holding it steady as you just extend one knee. Did you shift? Did you rotate towards that lifted leg? Can you bring yourself back to center? Bring that foot down. Take a breath. Exhale, belly pulling in, pelvic floor pulling in and up. Pull with your stable foot, extend the other knee. How does that work? Coming down. Try the other side. And coming down. We're just going to do 5 sets of this. Inhale down. Exhale, pelvic floor belly. Before I even move anywhere, I'm gathering that midline. And then down. Exhale, pelvic floor belly. And down. 2 more sets. Exhale, pelvic floor belly, holding myself as stable as possible. Inhale. Exhaling, pulling with your bottom foot. And down. 1 more time each side. Exhale, find that center. That exhale, pelvic floor elevator and belly working together to hold me steady. And down. And exhale. And because we're only doing 1 leg at a time, it's very safe for this load into my split abdominal wall. So it's fairly safe. You may want to just practice lifting a foot off, you know. So then if you've got something between your thighs, you're going to take that away. Let your arms rest wherever they feel comfortable. And then we're going to move into part B of this, which is the same thread of ribs, navel pulling back, spine and trunk stable, 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 as you float 1 leg to a tabletop position, knee over hip. Now make sure you didn't flare that sits bone out, turn the leg in, hike that hip up towards your armpit. You want to roll in that hip joint, right? So you're letting this outer hip crease release. And notice if just lifting 1 leg up, you've already twisted, right? So you might be in a place where you're like, oh, my belly domed out and I rotated. And you go, okay, I got to just stay with 1 leg at a time. Bring it down. Keep it closed chain. Keep the feet down. Bring the other leg up, right? If you're kind of like, yeah, that's super easy and I'm holding everything stable, and when I bring that foot down, I don't like collapse, or you can maintain your awareness and your control, then you're ready for both legs to be up. So you could just do 1 leg at a time. Or if you can keep everything stable, no pulling in my neck, my shoulders are nice and wide, ribs are down, you can have both legs up. Now, did the belly dome up, or can you keep pulling that belly down? Down, 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 down. And then you're going to get your breath involved. So you're going to inhale down, inhale into that whole container of your abdomen. Exhale, pelvic floor and belly, pull in and up, your leg moves back to the tabletop position. Inhale down. Exhale, pulling in and up. Maybe for your body, you're like, oh, the inhale down makes my back arch. If that's the case, exhale, pelvic floor and belly as your leg goes out. Inhale as you bring the leg up. Right? So reverse or utilize the breath to support your body and what you're working towards, because everyone's experience and process is different. And this is about you finding your awareness and figuring out your foundational placement, right? What props do you need? What props give you the most feedback? What breath helps you? Where do you need a little bit more weight, a little bit less weight, a little bit more support? You just keep exploring that. Breathing, keep moving through it. We've got 3 more sets. You could flex your feet and tap your heels if you're like confused about what to do with your feet. I just kind of let my feet just hang. Try and like take something off my brain to be like, don't worry about it. One more time, each side. Really focusing on my form here. And if this is starting to go into your back, bring your feet down. So say you started with that both legs up and you're like, that felt great. But then you got into about 3 to 5 sets and you notice your back is pulling and your neck is pulling. Take it back down to one leg at a time. Peel it back to just extending one leg, right? Not even lifting that leg up and having to hold it there. So peel it back to any of those. Go back to the very beginning and go to your pelvic tilts for a moment. Exhale as your pelvis tilts toward your face. Inhale as it goes towards your feet. Notice if it feels any different now. 2 more. Exhaling, tilting your pelvis towards your face. Inhale, rolling towards your feet. Exhaling, gather maybe that pelvic floor, belly. Inhale, release, tilting it towards your feet. And then let it level off. Let your ribs drop, pelvis relax, shoulders relax, and just rest there. When you're ready to come up, you're going to roll yourself to one side. Take a moment there and just be like, okay, I've got this. Use your arms to help you either come to hands and knees if you're coming all the way up to standing, or you can just come to sitting. All right, so this is just foundational work, right? It's just about you, figuring out what props you need, right? Do I need more head support? Do I need less head support? Do I need a little padding in my back? Do I need something underneath my sacrum? Do I want something between my legs or not? Where do I like that between my legs? Do I like it closer to my pubic bone, closer to my knees? Where is that? And then how does your breath, belly, pelvic floor, how does that core function or not? And how can you just stay with that? And you stay with this for as long as possible, very slowly adding more repetitions or adding more sets. So maybe you're like, okay, I did 5 to 10 repetitions. That's all I got. And then in 2 weeks, after you've done this a couple of times a week or every day, in a week or 2, you're like, oh, I can do a whole nother set of it. So you slowly build on this. All right, until next time, keep moving.